Abbiamo Mateus Romão, dottorando all'Università di Pavia, però al momento sei in Inghilterra Buff.
No, sono in Brasile adesso.
Ah, ok. È stato a Buff perché lui sta collaborando col centro studi di Buff. Infatti sarà in inglese la
Mhm.
presentazione.
Good morning, everyone. Good afternoon, everyone. I'm going to present to you today just a little piece of my PhD. And today's presentation is going to be entitled "Living with Death: How
Mateus,
Exposure to
scusami.
Death."
Matteo, scusami.
Sì?
Voce più alta. Tutto
Ok.
qua.
Meglio così?
Oh, tu semplicemente vai bella, voce piena e vai sereno.
Okay. I'm going to present to you today a little bit of my PhD, and my presentation is entitled Living with Death: How Exposure to Death-Related Scenarios Changes Life Prospects and Promotes Growth Among Death Care Workers. Death work is a term that describes people who work with death, dying, grieving, and loss in some way. I have to be honest that I struggle to find the literature a definition of the concept of death work or death care work. So I would like to ask you today to have in mind that when I talk about death work or death care, I'm talking about workers involved in the pre and post death scenario. As you may know, death work is more than logistics or procedures. It's a form of care that helps to honor the dignity of those who have died and support the families and communities they leave behind. It involves emotional labor, ritual, and lots of responsibilities associated with the care of a dying patient, caring for a deceased, supporting grieving families, handling traumatological death, preparing the body, and organizing and conducting funeral services. All of these activities has a direct impact on these professionals' quality of life. This impact might be both positive and negative. If these professionals have proper and positive personal resources, such as resilience or coping strategies, they might develop vicarious post-traumatic growth. However, on the other hand, if they don't have these positive personal resources, they might develop compassion fatigue, death anxiety, secondary traumatic stress, or even burnout. I'm going to focus today about vicarious post-traumatic growth, but I would like to give you a glimpse about what burnout is. Burnout is a response to occupational stress characterized by three dimensions: exhaustion, dispersonalization or cynicism, and reduced performance. In emotional exhaustion, the person might feel overwhelmed or drained even after periods of rest. This personalization or cynicism regards the feeling of being detached or or having an apathetic attitude toward work responsibilities. There are lots of feelings of frustration or a general lack of enthusiasm regarding work. Professional inefficacy refers to a declination of the productivity and the performance at work, feelings of being competent feelings of being competent to handle work tasks. What is important to consider regarding burnout? These symptoms might be associated with workplace, and the person might experience depression and anxiety as a comorbidity. There are lots of risk factors associated with burnout, but we wanted to know what are the risk and protective factors associated with burnout among death care workers. So, to answer this question, we conducted a scoping review and we analyzed 47 articles that we found that as a risk factor, demographic and personal data might influence burnout in a negative way. For instance, young women with less years of experiences are more vulnerable to burnout if compared with older women with more years of experience. Work-related factors such as workload, job position, ethical dilemmas, and exposure to stress. Ethical dilemmas here refers to someone working in palliative care and needs to take a decision regarding someone else's life. This might be considered challenging and a risk factor for burnout. and psychological and social factors, including the lack of social support and coping strategies and emotional distress. Protective factors are education and training. For instance, death education that it involves a set of activities aiming to reduce death anxiety and trying to focus on death attitudes, personal resilience and coping strategies, and working conditions such as having a supportive team, autonomy, clear organizational culture, and ethical protocols. There's a set of consequences for burnout from physical to professional. From physical, we know that people experiencing burnout, they are more vulnerable to cardiovascular disease, prolonged fatigue, and respiratory problems. From a psychological perspective, this person might experience insomnia, depression, and other mental disorders. From a professional point of view, there is a higher job dissatisfaction, absenteeism, and less engagement. Like I said, I'm going to focus today on vicarious post-traumatic growth. And this concept is really interesting because it refers to a positive psychological transformation that emerges from indirectly facing traumatic and challenging events in the workplace. It's different from post-traumatic growth because the trauma is experienced indirectly, in the sense that the person who might experience it will see or listen to the things. Vicarious post-traumatic growth refers to the profound shift in the worldview that occurs in 5 key areas. Relating to others, new possibilities, personal strength, spiritual change, and appreciation for life. Like I said before, to vicarious post-traumatic growth happened, it needs to be mediated by the resilience, social support, organizational support, education, years of experience, and etc. Nonetheless, I would like to highlight that studies in vicarious post-traumatic growth are mainly conducted in nurses, physicians, and psychotherapists, and almost never in funeral home directors or workers in general, cemetery workers, and forensic personnel. According to Tedeschi, these are the 5 key areas. Relationship with others refers to the person feeling a stronger emotional connection and greater empathy. Personal strength is about realizing inner resilience through adversity. New possibilities, finding new life paths after disruption, appreciation for life, the person feel a greater value placed on everyday moments, and spiritual changes, there's shifts in beliefs, meanings, and purpose of life. So we conducted, trying to understand vicarious post-traumatic growth, we conducted a qualitative study, more specifically interpretative phenomenological analysis, because we would like to understand the lived experiences of deathcare workers. And because of that, IPA was the most appropriate methodology because allow us to have an idiographic approach and an in-depth perspective about a specific phenomenon. With this approach, we can understand and analyze subjective meanings. So we conducted semi-structured interviews online or in present. We audio and video record them. Then we transcribe and analyze them verbatim following the 7 steps of IPA. As an inclusion criteria, we asked for our partners for at least 4 participants with more than 10 years of experiences, both male and female, and 4 participants with less than 10 years of experiences, both male and female. In total, we interviewed 46 deathcare workers from different disciplines, genders, and years of experiences. As you can see here, we interviewed forensic pathologists, palliative care workers, funeral home, and cemetery workers. Professor Kate Woodthorpe, in a beautiful way, described them as following. Forensic pathologist, she believes they are the advocates who provide sense and justice for the disease. Palliative care specialists, they guide and support others through the transition between life and death. Funeral home workers, they care for the deceased. And cemetery service providers, they are the guardians of the deceased. We had a whole interview, but what I would like to show to you is this question. How do you think your professional experience has influenced your life, your view of life, and death in general? So we found three very interesting themes: appreciation for life and being present, authenticity and spontaneity, pragmatic view of life and death. In the first expiration statement, appreciation for life and death and being present, participants repeatedly highlighted that being close to death every day made them deeply aware of life's fragility. Their stories show clearly how this awareness helped them value the present moment even more. Instead of putting things off, they prioritize in spending quality time with loved ones, engaging in social activities, and pursuing meaningful experiences, as we can see in these quotations here. This work, dealing with often desperate cases and facing death daily, make us see things not necessarily with the right perspective, but with the right measure. It helps us put things into perspective and not complain about trivial matters. It allows us to give the proper weight to things, realize how fortunate we truly are, be grateful, and not to take anything for granted. A female working 25 years as a forensic pathologist. It has changed a lot because seeing young people dying changes you. After I started this work, I have developed a wisdom that helps me to live better. I enjoy life much more. I celebrate life more often. I live with a different enthusiasm. A female working for 6 years in palliative care. We spend time arguing about things when life is meant to be lived, right? The time we have should be used to live, not to argue. A male working for 27 years in a cemetery. The second theme, authenticity and spontaneity, refers to the idea that facing death so often seems to push participants toward living a more authentic and spontaneous way. They realize that putting off what matters is risky because the future isn't guaranteed. Many talk about letting go of hesitation and thus doing what feels important now. Their stories reflect a shift from strict planning to a more open, flexible approach to life, grabbing opportunities and living more genuinely without delay, as we can see. What I have come to understand is that you have to live day by day. Sure, make plans, but don't spend too much time overthinking. A female working for 6 years in palliative care. Life, yes, the possibility of dying at any moment sometimes makes me say, live life and make the most of every moment you can. A female working for 5 years as a forensic pathologist. What I don't do today, I do it because I don't know if I will be able to do tomorrow. Life for me is a roulette. Today you're here, tomorrow you're not. A male working for 20 years in a funeral home. It made me reflect a lot on time, living each day to the fullest because every second could be the last. Life is to be lived. The time we have should be used to live. A male working for 5 years in a cemetery. The last theme, realistic and pragmatic views on life and death, came up again and again and again. And honestly, it surprised me with how strongly it was felt by the participants. It's the way this work pushes people toward a much more realistic, even blunt view of life and death. For many of these workers, constantly being in contact with death doesn't make them reflect. It actually changed the lens through which they see the world. Some talk about letting go of religious or spiritual beliefs they once held because what they witness every day doesn't align with those ideas anymore. It's not that they are just cold or cynical, it's that they have seen so much, they need something concrete to hold on to. There is a kind of existential honesty that develops. Death isn't abstract for them. It's right there, every day. And that kind of repeated exposure just doesn't influence how they do their job. It shapes how they think, how they believe, and how they live, as we can see. From what you actually see and touch with your own hands, the resuction will never happen again. I forgot to put here, but it's a male working for 10 years in a cemetery. Yeah, I always have a bit of distortion, maybe, always seeing more extreme cases. So when someone I know receives a certain diagnosis, I already associate it with something negative, like they're going to die from that. So yes, in that sense, my view is a bit distorted. A male working for 1 year as a forensic pathologist. Certainly, before doing this job, when a patient die, I experience it as a problem, as if something had gone wrong. But then I understood that death is the most natural thing there is. It's really a bit like birth. So it's hard to understand, especially for people in general, not just patients, but even our own family members. But there comes a moment when it arrives, and even if it happens prematurely, as it often does, it's still part of life. A female working for 7 years in palliative care. So, these findings suggest that working with death doesn't only bring stress, it can also foster a profound existential growth and change. Starting from the theme 1, appreciation for life, this theme lines up perfectly with one of the core areas of the growth in the model that I showed to you earlier. A lot of the participants share how being around death every day made them more present, more grateful for little things in life. They talk about not taking time or people for granted anymore. Then we have the second theme, authenticity and spontaneity. This connects with new possibilities and personal strength. Some people describe how they have started doing things they used to pull off, like going out on vacation or saying yes more often. There's a real shift in priorities, and it often comes with a deeper sense of control over their lives. The team three, realistic and pragmatic views on death, it's a bit more complex. On the surface, it might sound a little bit detached or even disenchanted, but in reality, it shows signs of spiritual change and personal strength. For some, it meant letting go of beliefs that no longer make sense based on what they see every day. And yet, what replaces that is an emptiness, it's clarity, a grounded, peaceful acceptance of death. So, overall, what we are seeing is that death doesn't take something away. For many of these professionals, it also gives something back. It shapes them, it helps them grow in ways that are quiet, powerful, and deeply human. So, to conclude, I would like to highlight that death care workers might be vulnerable to burnout and vicarious post traumatic growth. And it is necessary to develop target interventions to mitigate the side effects of death and suffering exposition, specifically for burnout. And more studies are necessary to understand burnout in this context. Death care workers are often misjudged or forgotten by the literature. So it's important to develop it's important to conduct research specific to funeral home workers, cemetery workers, and forensic workers because they are those who are often forgotten. So, before ending my presentation, I would like to give you a glimpse about what burnout looks like. Cremating a body is the same as baking a cake. You just put the body inside the oven. The difference is that the cake can go wrong, a body cannot. A male working for 13 years in the crematorium. Well, now I don't have any feelings because during autopsies, the dead are dead. They are dead bodies, so they don't evoke any sensations in me. And I can't take it anymore. I want to leave this job. I have applied for another one and I'm waiting for the answer. I can't sleep. I'm anxious. I hate to be here. This is problematic because death is one of the most extraordinary events in anyone's life. It's never just a body. It's a whole history. It's someone love, it's someone father, it's someone son. So for this reason, it's highly important to mitigate burnout in this population. And because of that, I would like to invite you to contribute to my research on burnout in deathcare workers. To access the questionnaire, it's you just need to use the QR code. It's quick, only 15 minutes, and everyone that is has contact with that can answer them. If your role is not there written, you can just put in altro e scegliere quello e mettere lì il tuo ruolo. Uh, the references for today, and I would like to thank you very much for listening to me, and thank you, Nemo, for providing this space for this beautiful event. Thank you very much.
Grazie Matteus. La parte di domande la facciamo direttamente in italiano o vuoi continuare a farla in inglese?
Va bene anche italiano.
Mm. Curiosità mia che all'inizio tornei con la camera, questi 46 lavoratori sono britannici o italiani?
Sono italiani? Sì, questo
Sono
campione
italiani,
è un
ok.
campione italiano, sì.
Nord o Sud Italia?
Nord Italia.
Ok, vabbè. Vieni al sud a intervistare i lavoratori del settore. Subito la domanda, però devi venire qua. Ah,
Complimenti per la tua presentazione.
Grazie.
Mi chiamo Giorgia e sono, non so se sono una death worker, perché lavoro su questo tema da tanti anni, e, ma sto facendo un dottorato e, non, e con molte persone, io sto seguendo come una tesi di dottorato le persone che subentrano dopo i grandi naufragi, tant'è che io uso il termine death work. La genealogia di questo termine viene da Claire Moore sì, Economic School of London. Quindi magari ti interessa perché lei ne fa una piccola genealogia, ma lei parla di death work e extraordinary death work, parlando dei forensi, forensi umanità internazionali. Io invece mi occupo del fiction forensic. Ma domandandomi se fare o meno il tuo
scenario.
questionario, grazie, mi domandavo anche, c'è anche una particolarità riguardo non soltanto al tema del lavoro, ma al lavoro in sé. Cioè, appunto, ripeto, ieri è il 1° maggio, cioè io sono una dottoranda, il mio burnout è dovuto al mio dottorato o al tema del mio dottorato o alla mia condizione esistenziale di giovane trentenne senza prospettive, cioè, no? E quindi mi domando anche i tuoi lavoratori se, giustamente immagino, tu hai fatto pure un ragionamento sulle condizioni di lavoro a prescindere dal tema di lavoro. Quindi mi domando questo qua, come integrare queste due parti importantissime della tua ricerca. Grazie.
Io non so se ho capito bene la domanda. Eh,
La rifaccio.
per favore.
Nella tua analisi,
Secondo me invece velocemente.
your analysis, have you developed back also the condition of work, not only the theme of work?
Ah,
Meaning that many of these people might have burnout not just for the theme, but for their material condition in which they happen to work and the relation with the owners, etc. Thank you.
okay, okay. Uh, yes, we are testing a model. It's called GDR, and it's a model that has two dimensions, if I can say that: job demands and personal resources. In this dimension, job demands, we are gonna have access how the organizational culture and how everything related to the workplace impact the outcome in the worker's professional quality of life. If these job demands increase the probability of developing burnout or decrease it.
Thing was perfect on the point. Like, yes, so they consider it.
Yeah.
Any other question? Um, eh, when you were talking about this, think about being a PhD, and I was thinking about Nives. Nives is part of the directory board of NIMO. She's a PhD student, young PhD student, and she works with the doctors that do autopsy on dead migrants.
Mm.
That is a truly heavy topic, but Beyond that, she's also a PhD student in Italy with all the uncertainty she can have. And it's also sometimes it's also the thing that doing research on this topic can be stressful just because you don't have anyone to talk with.
Yeah.
Because if you're in your department, you are the only one doing this, can be problematic. I was lucky because in my department, I had many colleagues doing similar work. It was very funny. But again, doing a PhD in some topics in a department with nobody else doing that, you are the weird one. Hmm. You have something to comment about it? You don't have to comment if you don't want to. But
Yes,
I don't know, reflection.
it's
You want
interesting,
to
but
go first, Mateus.
it's interesting, but I take proud of being the weird one. So it's not like a personal resource, like how I cope with this, that also protect me from the negative outcome of being the weird one.
Okay. Can I? You go first. I want to add a thing. Like I do funeral since 2011. Now I do research on shepherds, and I went to a conference in Geneva, and I was the only one. Like I was like, look, I'm new to this field because I usually do funeral, and people were laughing at me. Then were curious, but I actually, in my own way, I enjoy to be the butt of the joke personally, but can be problematic. Go, Richard.
I simply wanted to say what I was trying to dire that as a humanist funeral celebrant, part of the community of humanist funeral celebrants, both in the UK and in Italy, che faccio parte della comunità dei celebranti funebri sia in Italia che nel Regno Unito, both in the UK and in Italy, we have a protected space just reserved for us, where we go to shout at each other. Noi abbiamo sia in Gran Bretagna sia in Italia uno spazio aperto online dove sono consentiti soltanto i celebranti e dove noi andiamo per urlarci addosso, per scaricare, perché quando tu devi fare il funerale, per esempio, che ne so, di una ragazza suicida a 14 anni perché è diventata, è complicato.
Mhm.
Do you want to add anything, Mateus?
I would like to know the name of the place because that's brilliant. That's brilliant.
It's a secret. You must
I
be. You must become a celebrant.
okay.
It's a secret club. We are going to make our own club with for academics. Mateus, grazie. Grazie a te, Mateus.
Grazie a te. Grazie.
Grazie a chi ci ha seguito online, grazie che è venuto in presenza.